Hello everyone and welcome back to my channel. It's your girl Omoba Damilola and this is a diary of a sickle cell victor. On today's episode, we will be talking about stroke in children with sickle cell anemia disease. I know that I posted this last week or 2 weeks ago, but I had some copyright issues. I'd used something that was, I couldn't post and I was having issues with it. So I had to pull it down. And so I still need people to know about these things. So that's why I'm doing this video again. So yes, stroke in children. A lot of people will be wondering, how come? Why will children be having stroke? Children. Yes, in sickle cell disease, our issues are a bit complicated, and we suffer stroke. Yes, and even from the ages of 2 to 16. Yes, children, those with sickle cell anemia disease suffer stroke. Now, what's stroke? Stroke happens when there's a blockage to the organs, to the blockage of blood flow to the brain, and when there's that blockage and the brain doesn't receive blood, especially oxygenated blood, it can be affected. It can cause a damage and all of that. And we also know that other parts of the body inside us, the eye, for example, is an organ. The ear is an organ. The lungs, the kidney, and the rest of those things are organs, and they need blood, good blood. So for those with sickle cell anemia disease, we have this problem because most of the time blood vessels in the brain can be blocked, can cause sickling and all of that, and this can affect the blood supply to the brain, and it can cause a damage. I had a brain hemorrhage when I had my daughter, like close to 6 years ago, so I know what I'm talking about. So this can cause damage, and children also suffer damage like this. We have special type of cells that carry blood around to the organs. Our cells are not fully circular shape. Our bone marrow produces circular shape cells, full cells that look like the full moon, and so most of the time the cells that our bodies produce are usually sickling, like they are sickle, like the moon, the crescent moon, or banana shaped kind of cells, and those kind of cells are not enough. They do not carry enough blood, and they do not carry enough oxygen that the brain needs, and so this can affect it getting to the right parts of the body. And then our cells last within 10 to 20 days, unlike the regular full moon kind of cell, that the AA patient has. Those ones are full and they last for 120 days. So 10 to 120 days, you can see that margin. And so most of the time our cells are already damaged. The cells carrying blood are already damaged before they even get to those organs, especially the brain. And this is why children suffer stroke. Now, what are symptoms we should be looking out for in children? Seizures can happen in children. You just suddenly see them jittery, or they're looking very funny. That can be a seizure happening to a child. And sometimes hard time breathing. I just went for a breathing test this morning. They're able to check that for me here as often as possible to check how well I breathe, because it's very important that you breathe in oxygen as our body needs oxygenated blood. So breathing, when you see that the child is finding it hard to breathe, it can be a sign of stroke coming. So please watch out for that. And then vision. Yes, the vision. Eyes are blurred. They are not seeing clearly. They're seeing 6 people instead of 1. or two people instead of one, that's a sign of stroke coming. So when the child is saying, I can't see, or I can't see clearly, it's blurry, I can't see anything, don't see it as a child making excuses, or, oh, it's because you want to use glasses. My mom accused me of that when I was younger. She said, it's because you want to use glasses, that's why. There's nothing wrong with you. Yes, please watch out for those signs. Those can be sign of stroke coming. Please don't ignore those signs. So like I said, the first one, seizures in children. Another one could be hard time breathing. The child says, I can't breathe, and is trying to gasp for air. Please, that's a sign of stroke coming. Take cognizance immediately. Then also the vision is blurred and the child is complaining about that. Don't see it as this child is, being extreme. Yes, then excessive sleep. They sleep so much. The regular child should sleep 8 to 10 hours. But these ones are sleeping 12. And then when they still wake up, they wake up very tired and still want to go back to bed. That's a sign of stroke coming. Please don't ignore these signs. It's very important that you do not ignore, so that you don't miss out on the things that this warning signs, because they are very strong warning signs that you shouldn't ignore. Or then tired. The child's always complaining, I'm tired. Don't tag it. Don't avoid name callings. And this is to teachers, especially teachers, because I used to be a teacher. In fact, I went into teaching because of the challenges I had growing up with my studies. I miss school often. I used to miss school regularly. I'm out of school. I'm in the hospital. By the time I come back, you're saying gibberish. And sometimes I'm lost. Sometimes I'm cold. I'm too hot when the class is happening. I'm not hearing anything. So the child is complaining about tired. I'm tired all the time. Don't think of the child as lazy. Also, parents, don't compare the child and say, and you're always complaining, you're always lazy. Don't you see your brothers and sisters? You don't compare them. They are different people. Every child is different. Every individual should be treated differently, especially those suffering from sickle cell disease. Please. And then headache. The child is complaining about headache all the time. Mom, I have a headache. My head is banging. I can't do this. It's my head. Don't tag that child as being lazy, please. Don't. That child might be suffering a stroke. And then another one, number 7, would be difficulty walking. That child is finding it difficult to walk, doesn't want to walk. She's standing and she's shaky and she doesn't want to walk. That can be a sign of stroke. I explained because I had that issue when I was growing up. I guess I was close to 13. And I was seeing the nurse. I was just recovering, and then I was seeing the nurse. There was a nurse close to our house, and I was supposed to go get my injection and treatment and stuff. So I was going to a clinic, to the small clinic that she has, and I was tired. I was going to my mom that I can't walk there. I know my mom, who is strict and doesn't really want me to always show that I'm sick, said, I know I should walk, and told my house help not to carry me, the house help to put me down, that I would walk. We had to get to a corner, and by the time we got to that corner, by the time we got to the corner, she just told me, you know what, just come behind me, please. See, oh yeah, boom. But saying me, I was too tired, so I went behind her. And then by the time we got to our nurse's place, right in front of our door, I had a seizure. In fact, I was convulsing. The whole neighborhood had to come. They put a spoon in my mouth. They took out I was naked. They stripped me naked so that I could have air. I almost lost my life that day. So that's a sign of stroke coming. Don't ignore and say, oh, this child has come. Oh, you're lazy. You are too petty. You're too this. Please avoid it. Weakness. The child is finding it difficult to move, like I said, or she's tired. The body is, she's just complaining that, they're just weak, or you are seeing that the face is, or the body, or something, the face is drooping and their body is like, is looking one kind. That's a sign of stroke. Please take note. take note of that. Or you are trying to wake the child up. You are waking the child up and the child is not getting up. That's a sign of stroke coming. It's nobody pursuing anybody in any dream. Grab that child and take that child straight to the nearest clinic or doctor, preferably a doctor who knows about sickle cell disease, because some doctors will just say there's nothing wrong with them. She can go, she's okay, and all of those things. So please, let's take note of these things because they're very, very important. And please don't tag your child as lazy. Teachers, please, especially when you know that that child has sickle cell disease, kind of treat them a little differently. I'm not saying you should call them names or make them look very special and not feel like they're mates and feel totally different from their mate. No, but just understand that these children are a bit different, and please try to work with them as much as you can. A lot of people have lost children, especially teachers. Then another major thing we should look at, all these type of strokes I've talked about are physical strokes that we can all see. There are some that we do not see. It's called the silent stroke. And this stroke affects the cognitive part of the child. The child is not responding well in the class. Like I said, this is not even tiredness. The child is speaking and it's slurred speech. Sometimes people might say, he's just trying to hide this thing. He's lazy, he's stupid, he's this. I was called names. I know what I'm talking about. Teachers called me several names. Dull, slow, stupid. No, that was then anyway. I am sure things have changed now because I used to be a teacher in Nigeria and I don't call my students stupid. But let's take it easy on them. Don't call them names. Once their speech is slurred, they're talking and it's looking as if they're stammering, that might be a sign of stroke. Or they are not complaining to you teachers that they cannot see. That's a sign of stroke coming. They are confused. You are talking to them and they're speaking confused. There's confusion in the speaking, and they are not balanced well. So please, I beg you, please, that's a sign of stroke coming. Call the nearest clinic, the nearest hospital that can take charge of it. On my next episode, I'm going to talk about the risk factor, the things that can be damaged if we do not take this into cognizance and we do not attend to it immediately. Thank you for watching. Stay tuned to more that will be coming in. And yes, last week, Friday was Sickle Cell Day. The day for sickle cell, special day like Mother's Day and all of that. Yeah, so we have a day. Sickle Cells Day, and in Nigeria I think I saw some kind of awareness and all of that, and I'm very happy that the awareness is coming stronger and stronger, and I hope it doesn't stop. We need it. Some of you in the developed countries, and all of that will say, why is it that you still get married when they know they have that kind of problem? Blah, 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 blah. We have many people that are not educated. We're over 200 million, don't forget. Some of you are just 5 million, like the country I stay here, you're just 5 million population. We're over 200. Very vast country, very big country. And many are illiterate. They don't understand these things. So that's why we still have many issues like this. So please bear with us. We will talk about risk factor on my next episode and the things that are pressing needs for us as sickle cell patients, especially the young ones. So until I see you again next time, please stay tuned and don't forget to like, subscribe, turn on the notification bell so you are the first to know when videos like this come up. And please share what other signs do you think that I have not talked about here and you want to share with us. And also, if you have solutions for us, you can also share. I'll also speak with my doctor friends that work with sickle cell patients, and they can share their own ideas with us. If you have any questions, put in the comment section, or you can send me a DM and I'll help you find answers to those questions. So again, thank you for watching and see you next time. Bye.